Discs, intervertebral discs, those in the spine. Okay, we've all heard of, or at least we know somebody, if not ourselves, who have got an issue with their intervertebral discs, the discs found in the spine. The name comes from, so I've got a model here, the name comes from inter, meaning between, vertebral, i.e. between the vertebrae and the disc, so intervertebral disc is the actual name for them. The makeup on these discs is such that there are two layers. Imagine either the sweet locket or otherwise a jam donut. Let's use a jam donut analogy. And the outer layer, the annulus fibrosus, and the inner layer, the nucleus pulposus. So the inner layer is somewhat liquid, the outer layer is tough and fibrous. Now the outer layer is 25 layers of eccentric crisscrossing fibrocartilaginous material, i.e. very, very tough, and it's designed to really undergo serious tension forces. So the point I'm trying to make here is it takes a lot of effort, a lot of force to actually cause a disc injury. Okay. More often than not, what I find is it's not the actual force that actually causes the disc injury, rather it's the actual position that the patient places them into, an otherwise vulnerable position that predisposes that to actually occur. Now, what we've got is the disc sits between the vertebrae. So this is the front, there's your side, looking at the side, and there's the front of the patient, this is the back of the patient. And what you've got over here is the intervertebral disc. And it sits between, well, really between the vertebral bodies. So the large part of the actual vertebrae, not the smaller bits over here. So it's actually on the frontal aspect. And here what you see are the nerves that go out, and these come out from apertures that are formed between the two vertebrae coming together. Okay, so if I bring this together, that forms an aperture, that little hole through which the actual nerve comes out. The aperture is what we call the intervertebral, again between the vertebrae. Foramen is a window. Okay. Now what happens is discs, when they bulge, so there are three levels of disc injury. A slip disc, which is what everybody knows it as a layman, which is what we call a disc herniation. After the herniation, what happens is that the disc, the annulus fibrosus, the outer layers, they can break, they can crack as it were. And that then is what we call a disc prolapse, because it then compresses somewhat. And then after that, once the actual liquid, the nucleus pulposus, that seeps out from the disc, that's what we call a sequestration. Okay. Now, most discs, the most common injury, so what happens is the disc actually bulges backwards. Okay, it always goes in a posterior direction. And it's not actually straight back either, it's actually in one direction, so it either goes in that direction or it goes in that direction. So it's what we call a posterolateral direction at a 45-degree angle, as it were. Now in doing so, what it can do is, if I remove the top one over here, here's a demonstration of a disc prolapse, or a disc herniation, my apologies, and it's gone in a posterolateral direction. You can see that it's compromising that little space through which the nerve was exiting. So that aperture becomes compromised, and the disc can then touch the nerve, causing an impingement or a compression of the nerve. Okay. The extent of that impingement is dependent on various factors, including but not limited to the direction, the extent of the herniation, amongst others. Now, okay, and level of degeneration is another key factor. So that's what happens there. And so, again, the second point here I'm trying to make is that it's not necessary that all disc herniations cause a nerve impingement. And that usually is what I find in practice. Patients come and they've got symptoms down the leg. The first and foremost what they've gathered is pain down the leg, radiculopathy is what we call it, nerve pain down the leg. I've got sciatica. And the answer isn't necessarily that. It depends where the sciatic nerve is impinged and whether or not in the first place it is actually the sciatic nerve, which again I find more often than not is not actually necessarily the case, nevertheless. So, going back to the analogy of the donut, the herniation is where the actual donut creates a little bulge in it. That's the slip disc. And now we've all come across a hernia. A hernia essentially is an outpouching of the viscera, of the organs inside our abdominal cavity, through a weakening in the wall anywhere. So if you create a weakening in the actual wall that holds the contents, you will then, once we exert pressure, once we increase the intra-abdominal pressure, that will cause the actual contents to come out through that weakened area. And that's a herniation in whatever context. Here, we've got a weakening in the annulus fibrosus, thus causing the nucleus pulposus to push through it, hence the term herniation. And then, like I said, we get the prolapse, where the actual doughy part of our donut actually becomes broken, it becomes compressed and therefore breaks. And that also comes with some level of compression, after which the next stage is sequestration, where the actual nucleus pulposus jam bit actually comes out of the donut. And in the case of a sequestration in the human body, what happens is, you see that the big thing, that's a spinal cord. Of course, not in the lumbar region, that's another topic. But what happens is the cord runs through the spinal canal, this space, okay, the space in the spinal canal. The sequestration causes the nucleus pulposus to occupy that space, thus compromising it, and that is what we call spinal stenosis. Okay? Spinal stenosis, i.e. narrowing of the spinal canal. I hope that was helpful. Any comments, queries, don't hesitate, and if you like any of the videos in particular on a particular topic, don't hesitate to ask. Thank you for watching.